Hello, my name's Kate Davis and I'm an independent fertility nurse consultant. I want to talk to you now about the top things that you need to know before you start trying to conceive. So the first thing is as soon as you can stop hormonal contraception, the better. So that might not be very practical if you don't want to start conceiving straight away, but ideally, if you can stop it, say 9 months before you want to start conceiving, then that means all of those hormones are out of your body and you're going to stand yourself in best chance of conceiving as soon as you want to. The reason being is it can take a little bit of time with certain hormonal contraception to get it all out of your system. So for example, the contraceptive pill, when you first stop taking the pill, you can actually be really fertile for the first month, but then we seem to see that fertility then declines a little bit and it can take another 9 months before your fertility returns to normal. So the longer you can give yourself to be healthy and have all of those hormones out of your body, then that the better. The next thing I would say is start taking folic acid before you want to start trying to conceive, ideally 3 months before. That means that your maternal folate levels have increased and that then therefore your risk of any maternal defects to the baby, such as neurotube defect, are going to be a lot less if you've got lots of that folic acid and good maternal folate levels on board before you start trying. The third thing I'd say is start thinking about what healthy changes you can make now. So these are like the lifestyle changes, the things that are going to make a real difference to your fertility. So for example, if you smoke, stop smoking as soon as you possibly can. The other things to think about are having good nutrition, so feeding your body with good foods, lots of different fruit and veg, keeping red meat low, but enjoying red meat unless you're vegetarian. Then do make sure that you find protein sources elsewhere, but chicken and fish sources are also great proteins, lots of omegas, keeping your refined carbohydrates, the sugars, the things that we want to eat, biscuits, cakes, keeping those as low as you possibly can also. So having a really good diet is really helpful. It's going to benefit you in the long run, but it's also going to mean that your body mass index, your BMI, is hopefully abnormal for your height. And that's important because we do know that women who are either overweight or underweight can take longer to conceive. So just being mindful of those things. You might want to start thinking about your alcohol content as well and perhaps reducing that. You don't need to stop it straight away, but certainly reducing it to make sure that then you're nice and healthy. The last thing that I would say is it's really important that you know that it can take a little bit of time to conceive. It doesn't always happen the first month of you wanting it to. And I know that's frustrating because when you want to have a baby, you want to have a baby yesterday, not having to wait months and months on end. But what's important to know is it can take about 12 months. By 12 months, 80% of couples have conceived. So if you don't conceive in the first few months, don't worry too much. It will happen. If you get to the 12-month point and you've not conceived, however, then you need to start thinking about that. But it's important to be aware that when you first start off, that it might take a little bit longer, and don't be too worried about that straight away.